The 2012 Foster G. McGaw Prize is proudly presented by the Baxter International Foundation, the American Hospital Association, and the Health Research and Educational Trust.
Despite the fact that it's this beautiful city that people love to come and visit, there are many poor people, many vulnerable people.
We have to, as a healthcare organization, not only concerned about the general health and treating people's symptoms, but we also have to be concerned about the environment in which they live.
Well, here in Savannah, with our population, there's a lot going on with people in multiple fronts, aside from just showing up to the hospital because they're ill. If you are a health system, then I think you're making a statement to your community that you are a partner in their overall health. It's not defined as the acute care phase or when you show up in an ER. You know, it's a much broader definition of the word health.
We really walk with people until they get what they need. And eventually they understand that we're on their side, that we're their advocates, that, you know, that they can trust us.
Here we've been very fortunate with our governing board, who have funded these outreach efforts for 12 or 13 years now through good economic times and challenging economic times. It's getting out into that neighborhood setting where people live to make sure it's convenient and they understand it and it's accessible.
We're offering health care to a population that really needs health care. We serve the Hispanic population primarily. We're trying to keep them out of the ERs by offering health services to them from GYN, cardio, primary, drawing their labs, doing any radiology tests, doing any routine preventative care for them.
It's important because there are many people who don't have the resources to access medical services. Sometimes what people earn isn't enough. It's just enough to buy food, that's all, but not medical services.
You're actually helping them. You can actually see a difference in their lives.
We're very, very fortunate in this city, in our community, that we collaborate with so many that all want to pool together the resources, and then we're able to put forth all that. Sometimes you cannot do it all on your own, and everybody needs help, and we all come together with great ease in the city.
It was like a way station, you know, in the desert. You know, I could come here and feel good about myself. I could come here and know that the world wasn't as rough as, you know, it seemed like sometimes.
That's where centers like the African American Center play such a pivotal role, because we do a lot of connecting people to resources in the community so those basic needs can be met. And we know that once we meet their basic needs, then they're ready to hear that health information.
This is a pretty tough neighborhood, you know, and right in the heart of it you have a place like this where you can get services and where there's safety and comfort too, and I think that's a good thing.
We kind of serve as a gateway to our healthcare institution, because we have this incredible opportunity to help people to understand all that the system can do.
Trust is built on time and faithful presence. We believed that if we could have staying power in a place over time, that we could affect a greater change.
Oh man, you couldn't get no better when you can get kids walk here, get help with their homework, let them know it's a different side of life and it's gonna get better. It's real helpful to be in a community like this that need it.
Our big thrust is education, but education in the very broadest sense. So helping people get GEDs, language development for young children. Financial education is also a big piece of what we do.
The Voluntary Income Tax Assistance Program is available to anyone in our region that we serve. It's a place where they can come and have their taxes done absolutely free. Health is not just the lack of disease, and so a tax program like this allows people to have better resources to take care and buy the things they need for their family.
One of the major things that we try to always measure is outcome and improvement in quality of life, and how patients feel, that they've been helped and has their life improved.
You can come in and get the proper help that you need. Like me, when I found the mass in my left breast, I came here with no problem. They helped me and took me in right away. Because if it wasn't for them, nobody would be here. So thank God, the clinic is here.
Between all these diseases, they're looking usually at about 2 to 3 visits per month to the ER. And we're able to manage that on an outpatient basis, keeping them out of the ER, decreasing costs tremendously, and giving them the kind of care they need.
You just feel like you've given a little boost of hope here. So, and I think that's what we try to do, give boosts of hope.
Every day, working with community partners, St. Joseph's Candler demonstrates its commitment to bringing good health and health care to its neighbors. So congratulations to St. Joseph's Candler Health System and to all the 2012 finalists for leading the way to a healthier America. We're proud of you.
Congratulations to the 2012 winner, St. Joseph's Candler Health System, Savannah, Georgia. We also honor the finalists: Cheyenne Regional Medical Center, Cheyenne, Wyoming; Seton Healthcare Family, Austin, Texas; Yale New Haven Hospital, New Haven, Connecticut;